Schizophrenia is a mental disorder and characterized by reality distortions. The results are unusual behavior and limitations to everyday life. There are different types of schizophrenia with different symptoms. For example, disturbances of thought, hallucinations, unusual and inappropriate behavior, or deficit and restricted range of emotional responsiveness. Schizophrenia was previously known as dementia praecox, but in 1908 the Swiss Eugen Bleuler corrected the theory that the disease was an organic brain deterioration and renamed the mental disorder schizophrenia. The origin of the name is found in Greek in the mix of the two words to split and mind, but it's also known as a split personality. There is no first case in schizophrenia. Mental disorders affected people since the beginning of human life. There are documented records of descriptions of people with hallucinations and atypical behavior. This disorder and behavior was always associated with madness. But also the cause for schizophrenia is non-specific. There is no evidence for a real genetic inheritance of schizophrenia, but it is shown that there is a higher risk to develop it if there is a family history. The social environment, the family situation, poor social interactions and living conditions, and any experienced infections and traumas in childhood, but also drug consumption, can be important factors in schizophrenia. The most affected body part by this disease is the brain of the patient. The brain of a patient with schizophrenia is overwhelmed and over-responds to too many signals and stimuli in the environment. Schizophrenia can be divided in three main types: disorganized schizophrenia, catatonic schizophrenia, and paranoid schizophrenia. In disorganized schizophrenia, the patient struggles with organization of speech and thinking. Difficulties with appropriate behaved and controlled body movements would be the catatonic schizophrenia. Paranoid schizophrenia is expressed by strong delusions and hallucinations. First signs are shown in the late teenage years and early adulthood. The symptoms can be classified in 4 different categories. There is no exact test to diagnose schizophrenia, but several symptoms should be clearly present during a time period of 1 to 6 months. To diagnose schizophrenia, doctors will order a few tests to rule out other disorders and conditions. While there is no simple way to prevent schizophrenia, it is a treatable disorder. The treatment depends on the type, symptoms, outcome, and stage reached by schizophrenia. This disorder affects men and women in the entire world equally, but men appear to develop schizophrenia earlier than women. Schizophrenia requires a lifelong and regularly updated treatment to manage the patient's condition, reduce the symptoms, and to enable a normal life. Most commonly used are antipsychotic medications. They control the patient's symptoms by affecting the neurotransmitter dopamine. Also important for the treatment are psychological and social intervention, communication,